Hi, Rocky River. My name is Adrienne Hill. I'm a paramedic with Atrium Health's Community Paramedic Program. I work for Med Center Air, and while most people, when they think of a paramedic, think of somebody that works on an ambulance or somebody that works on the helicopter, I work in what's called a QRV, or a quick response vehicle. I work with physicians and nurses to go to patients' homes and to see them and allow them to talk to doctors through virtual, kind of like what you do with school. When you talk to your teacher while you're at home online, I allow patients to talk to doctors in the same way. I draw labs and do physical assessments, just like what you get done when you go to the doctor's office sometimes. I also have to give medications and start IVs so that patients can get IV fluids just like they would in the hospital. I've worked in EMS as a paramedic since 2005, and I've worked in EMS altogether for the last 24 years. I got into EMS straight out of high school and have worked in several different states. I've worked in Mississippi, Louisiana, Arizona, and now North Carolina, as well as South Carolina. Aurelia is my daughter, and she is in kindergarten in Miss Daniel's class. And while she has gotten to see me work in other settings, she hasn't seen me work on a QRV, because many of the patients that we're helping now, while they started as patients that were getting organ transplants or that were getting cancer treatments, some were even children and recently released from NICUs or from long-term stays in the hospital for treatments for cancer or for problems that they may have had from birth. Now the patients that we see primarily are COVID patients. So I go into the patient's house and I help them as well as the doctor to make sure that those patients get to feeling better and are able to stay out of the hospitals as well as to stay out of the community so that other people don't get sick. When I go into those houses, I have to wear PPE or gown up and take precautions so that I don't get exposed to anything, and also to make sure that the patients are able to stay safe. I'm going to attach a couple of pictures to show you what a QRV looks like, and so that when you see us on the road, you'll know who we are, and maybe it's me or maybe it's somebody that I work with. But I'm a community helper and have been for over 20 years now. I hope that whatever field you decide to go into, that you enjoy it as much as I enjoy my job. I love helping people, especially children and their families. Take care. See you later.